So we have an order for Zantac 50 milligrams IV piggyback every 8 hours. I did my drug problem, so if we're using gravity, it's going to be 25 drops per minute, and then a pump would also be 150 milliliters per hour. So then I'm going to check my physician's order to my MAR, and I'm looking for patient's name, dose, time, route. The patient has no known allergies. I'm going to compare my medication to my MAR. The expiration date is good, and it's not cloudy, it looks good. Now I'm going to go to my drug book, and it says 50 milligrams every 6 to 8 hours is a safe dose, so we have a safe dose. It is already diluted in 100 milliliters of normal saline, and it's compatible with normal saline, and that is what we have hanging up here. So we are going to monitor vital signs and pain levels frequently. And then this dose is going to be given over 15 to 20 minutes. Okay. Now I'm going to go to the med room and gather up all my equipment. And I'm going to wash my hands. I'm going to prime my tubing. Okay. Now I'm going to label my bag per the hospital's policy with the name, the dose, the type of medication, and the date. Now I'm ready to go to the patient's room. So I'm going to identify the patient using name, date of birth, and check it with an armband. Then I'm going to explain the procedure, and he is, I'm going to say you're given Zantac IV piggyback, and then we're going to ask the patient if he has any allergies. He has no known allergies. And then I'm going to see if the line is still good. So I'm going to lower the bag, and it's still good. I'm going to check and see if the IV site is still good. There's no redness, swelling, or anything like that, so it looks good. Okay. Now I'm going to wash my hands. I'm going to go ahead and lower my primary. I'm going to hang my secondary. Then I'm going to clean the port closest to the bag for 30 to 60 seconds. I'm going to open this up. Alright. You're going to regulate Now you're gonna watch for a minute. Now the infusion is complete. So we're gonna discontinue this. Okay, now we're gonna discard this. And then we're going to hang our primary back up and set it at the rate that it was set at before. Then we're gonna monitor our patient, reassess our patient, see how they're doing, and then we're gonna record in our MAR, and we're gonna record the patient's name, the dose, the time they're out, patient's response, and then the nurse's signature.